This podcast is highly sponsored by Thriveys. Thriveys is the first mental health product line with affordable products you can use whenever you need something to lean on for emotional or mental support. Currently, we have coloring books of all ages and affirmation mugs. There are some new products coming up, so you need to make sure that you check out Thriveys on Instagram and Facebook so that you don't miss out on the updates. And yes, listener donations are also welcome. You can drop your donation on 0770-338-440. The number is registered in the names of Navu Network. If you're not in Uganda, remember to add the country code +256 770 338 440. Hey, welcome to #Window Chiwanuka. This is the #1 African millennial podcast that sits at the intersection of mental health, self-discovery, and personal growth. If you're new here, welcome to your new virtual home. Be sure you hit the subscribe button wherever you're listening in so that you don't miss out on any of the future episodes. And if you're a returning listener, thank you so much for being the heartbeat of the show. We are very happy to have you, Dr. Agaba.
I'm very happy to.
For those who do not know who Dr. Agaba is, he does not really need an introduction. He's a resident psychiatrist. So if you need to have a full understanding or awareness of who he is, you have to draw back and do a search of the previous conversations we've had. So doctor, we're happy to have you.
I am always happy to be here.
Yeah, today is Mental Health Aware. Today is International Mental Health World. Hey, Jesus.
A mouthful.
There's so many words going on there. Yeah. Today is International World International. Oh, I still fail. I'm failing.
Is good.
I'm failing terribly. So this year's theme for the Mental Health Day is mental health in workspaces. And I think it's it's an overdue conversation. Because I think most of our time as adults, especially working adults, most of our time is spent in workspaces. Mm-hmm. Mm-hmm. And just a few weeks ago, there was a Kenyan lady who is an intern that died by suicide, coming from, I don't know if you had seen the story. You saw it? Mm-hmm. Yeah, where there were issues of underpayment and all these bills, and landlord was putting on pressure to make some payments. So let us dig into it. We have defined mental health a couple of times, but we can probably, for someone that is new on the podcast, can have an overview of what it's like.
It's been beautifully defined by the World Health Organization. So I think we can just stick to what's been put out there in that particular line. And I think it's also very important for us to continuously define it, because for most people, mental health is synonymous with mental illness.
Right.
And when they think mental health, they are thinking disease, which is not necessarily the case. Because so the World Health Organization defines mental health as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully. Their work is key, and is able to make a contribution to his or her community. It's not merely the absence of a mental health disorder, right? So someone may say, okay, I don't have depression, I don't have schizophrenia, I don't have ADHD. For mentally healthy, that's not necessarily the case. I may not have a mental health disorder or a mental illness, but that doesn't necessarily mean that I am mentally healthy. So the 4 characteristics that we have to be looking out for is what I've just mentioned. Can I realize my potential? And so if I am a podcaster, am I able to come and shoot these podcasts? If I am a DJ, am I able to DJ as I have the capacity to do? So if anything hinders me from being able to do that, then it's hindering my mental health. Can I cope with the normal stresses of life? The traffic jam, or it's exam season now. candidates are doing the exams, which is a normal thing that all of us have to go through. But am I able to cope? We tend to see a rise in mental health conditions around this time from schools. So for us, we're going to get a lot. Yes.
On your end.
Yes, we're going to get a lot of all sorts of things that happen. And that's a discussion for.
I like the way how you brought it out, because for the part of talking about the season, the very first time I've told you about this story where I was taken to.
Yes. I know it.
Oh, wow. Because I was going to say a psychiatrist, but then we just found out she wasn't. Presumably a mental health professional. But before then, I had met with they had taken me to the late Dr. Kanyerezi, who, when they were trying to understand what was happening in my life, I remember him asking, are you scared of the exams? Are you scared of senior 4? Because it was the first term of senior 4. But I didn't know where they were coming from with this. Because I didn't know what I was struggling with. So I just said, no, I'm not.
Of course not, yeah.
And I think if I was aware as a child that there is such thing as emotional well-being or mental well-being, I would have been able to
quickly make sense of that.
Yeah, to tell what it is that might have triggered my condition at the time. So I like that you've pointed that out.
Yeah, precisely. Because so we know that life has those, we call them normal stressors, that happen from time to time, exams could be in school. It could be getting married and the preparation for that. It could be the birth of a child. It could be an interview at work. These are all stressful situations, but they are normal stressful situations. It's part and parcel of our fabric as human beings. So I should be able to cope with those things. I mean, I should be tense, yes, because I'm sitting a final exam, but I should be able to cope and get through it. So if one is or the other, I can't quite cope. Many people, I'm sure you've heard of those stories of, guys are going for exams and suddenly I can't write, or suddenly I'm collapsing all the time, or there was this interesting story a while back of a candidate who went blind in an exam, So he walked into the exam, and then when they started, suddenly he couldn't see. And then they rush him to the sick bay, and then his eyesight is better. Then he comes back in again, and again he can't see. And then they pray over him, as they always do, and suddenly his eyesight is better again. Okay. For us, we know that was just a manifestation of mental unwellness or some form of illness as well, right? But yeah, because of the stressful situation that he was going through. Okay, so ordinarily that I should be able to get through this stressful situation to cope with the stress that comes with it. And if I can't, then my mental health has been compromised. I'm working productively and fruitfully. Okay, today's conversation is about mental health in workspaces. I should be able to work productively. But if for one reason or the other I can't, then my mental health has been compromised. I'll give an example. An everyday situation, I have a 5-month-old daughter.
They're 5 months already.
Yeah, 5 months today. And so, I mean, if I got a phone call right now that she's unwell, I would not be able to
we wouldn't go on.
Have this conversation productively. So I'm not able to work productively because of that situation. So I don't have an illness, but it's definitely affected my mental health, because now my mind is going to go, so, okay, where is she? What's happening?
If I delay.
Thank you. Right? So that's going to have an impact on my mental health. It's important that I recognize that. So if I'm not able to work productively or work fruitfully, then my mental health has most likely been affected. I'll also be able to make a contribution to my community. So in very many words, that's what mental health is actually about. And not so much about mental illness, which is a conversation for another day.
Yeah. Oh, we were actually supposed to have it. You remember?
We will. We will have it.
We cut that conversation in the middle at the time when we were supposed to be talking about mental illness. So if we're looking at mental health in workspaces, like I said, most of our days in life as adults, we are at work.
There's an interesting study I came across.
Which one is that?
It actually, I just picked a snapshot from what their results were, and they said that the average person will spend about a third of their life at work. That's about 90,000 hours over your lifetime that you will spend at work.
90,000 hours?
Yeah.
How are they calculating that?
I mean, you're looking at 8 to 5, over maybe 30 years of your adult life, before retirement. So on average, you spend about a third of your life. And again, this was a study that was done in 2007, before the whole work from home, career work home. So now it's probably a lot more because you see, with all these devices, we are working anywhere.
Around the clock.
Yeah.
Let us have an exploration of that. What are some of the things that we're looking at if we are talking about mental health in workspaces? And I'm asking this question. We had a conversation before we started the podcast, and I talked about how in 2021, I was like, you know what? I don't know if it was also part of the birthday blues, because I was nearing my birthday and I had all these questions of, is this going to be my life until I die? And I felt spent or burnt out, to make it easier to understand. And I was like, you know what? I'm going to try to have this mental health conversation with my boss. But I was also scared. So if I have the conversation with him, would it mean that I'm no longer competent for the job? Will he start looking for someone to replace me? And like I said earlier, that I don't remember how I started the conversation with him, but I remember him saying something like, hey, it happens. Although for him, at some point, he was like, mostly it is money. But when you get money, you'll be happier. he mostly
Not
pointed
very
out.
true.
I know, it contributes. And then he was like, most of the time it is money. You don't have money. And then he was like, but then when you see me leave work before 5 p.m. and I don't come back, what do you think? Sometimes I have calls coming in from clients. I can't pick the calls, and I'm also looking at my computer and I cannot function. So it happens when you feel like you are not. Then he was like, it is pointless for you to be present at work, and I know you're there, yet you aren't productive. You can't do anything. So it is best when you feel like that, come and speak to me. So let us have some exploration. How do we introduce this conversation on mental health in workspaces?
Okay. And I like that you bring up this particular example. So if I think about mental health in workspaces, maybe I think the first question is to just sort of get into how will it look like? Right? Like, what are the common manifestation of mental health issues in the workspace? And because this is what we see, right? And it's not obvious that we're going to point it to mental health, but oftentimes this is something you can see and realize, okay, something needs to be sort of looked into this. Yeah? Most common things that we see, one of them is absenteeism, right? Just like you mentioned, right? Boss not around. Okay, he's leaving before time, or he didn't show up.
Like, you don't even think about that because he's the boss.
But one of the common things that we see is that people just don't show up, right? So employees who are dealing with mental health issues are more likely to take time off work or not show up at all. Yeah. So you'll notice, hey man, this guy hasn't come to work the last 2 days, the last 3 days. It's likely that they're dealing with something that's affecting their mental health, So that's one, absenteeism. Yeah? Before we write the guy a warning letter, or before we withhold their salary or something, you might want to think twice, what's going on.
Yeah.
Why has so-and-so not shown up to work for a while? The other, very similar to that, is presentism, right?
Ooh.
So with presentism is people are actually in office, but they are not delivering, Nowadays, is this whole clock in, clock out system. So I clock in and I sit there, but I'm not doing anything, right? Like he mentions, I am here, I'm looking at my laptop, but
clients
I can't
are calling,
get anything done.
Yeah.
So I'm present, but I'm not really working. And that's another one of the manifestations. Oftentimes something is going on, something mental, So presentism is another one of the manifestations of mental health issues at work, and quite common, yeah. Especially when people have those, and we're going to talk about this later, but those workplace policies, you have to be in at 8, you have to leave at 5. And if you leave at 4:45, HR is going to call you and ask, excuse me, you left very early.
Mm-hmm.
I can't see you on the cameras. Why are you not on your desk? So yeah, some people will just sit there and you can see me here, but am I delivering? Do I have any output for the day? You realize, man, I'm scrolling on my phone or I'm staring into the blank space or having conversation the whole time I'm not getting work done. We call that presentism. The other is accidents and errors. Accidents and errors. There was a study that I think once published a couple of years back, and it was saying I think at the time, it was the third leading cause of death was medical error. I think it was at some hospital in the US, and when they did their studies, they realized the third leading cause was medical error. Because people are going to make mistakes, I was supposed to put 2,000 and I put 20,000.
Yeah.
So accidents and errors, oftentimes due to a lot of mental health issues.
Mm-hmm.
So that's going to happen oftentimes, We did the whole podcast and I didn't record.
I have done that.
Right?
I actually
has been shooting the whole time and he has not recorded. Funny stories. That happens sometimes. Guys go set up the cameras and everything and go. And not until the end does the guy realize, guys, I wasn't recording.
The kind of thing. So I use borders for my main transportation, and sometimes you get to the end of the trip and this guy's like, I did not start that trip.
I didn't start the trip. Yeah. Okay. So a lot of these will tell you that something's going on. So accidents and errors. Again, also, you're at the workplace and this guy just keeps having mistakes in his work. You should be thinking something's right? Don't just brush it away, especially for someone who to be good. By the time you employ this guy, that they are diligent with their work or they have the potential to do amazing stuff and they've delivered oftentimes in the past. So someone who's been stellar at what they do and then suddenly they have all these errors coming up and suddenly you should be thinking something's up and we need to look into it. And then of course the other, all these tie into that productivity. Yeah. So you find that productivity has just gone down, right? Like I used to record 3 podcasts a day. I can barely get 1 a week, reports are always in on the 3rd of the month. It's the 14th. I still haven't submitted my report for last month. Or, my numbers are going down. You realize productivity is going to go down. Oftentimes it could be something, mental health related. Mm-hmm. So you want to, this is just the most common things that will sort of jump at us in the workplace that should get us thinking. Mm-hmm.
The first time you talked about presentism, I quickly went to people using workspaces as a coping mechanism. Mm-hmm. And that's what I thought you were going to be talking about, presence even beyond 5 o'clock. I'm going to stay here, and they leave as far as 10 o'clock. Sometimes it's not even the workload, but using work to cope with life. That's what I thought you were going to put across.
That there is some truth to that. That there's people using work as a sort of coping mechanism as well, but that wouldn't speak very much to the workplace. That's more of things spilling over into work.
Yeah,
has a sense.
It does.
I wouldn't quickly categorize that as a workplace issue.
Oh yeah,
per se. But sometimes it will come in, and again, we're going to talk about that ultimately because our workspaces also have an influence on that, right? So if you're in a space that pays more attention to your productivity, to your numbers than to your person, then I'll be pushed to just put in a few more hours, right? Mm-hmm. So, for example, you're very well aware that employees are entitled to leave.
Yeah.
Right? But there are very many workplaces that will be happy if you don't take your leave. Even
castigate you.
Even encourage.
Even encourage.
Yeah. and give all sorts of bonuses to people who work more.
Oh, that.
Right? So someone will quickly think about, okay, let me work some more, right? Or let me stick around a lot longer. But as you'll see, one of the things that we recommend for workplaces is to be very, very keen on ensuring that people rest, right? Keen to ensure that people take leave, I know of a certain place where people are forced to go on leave. It's if we have to deactivate your ID card, we will. Because you have to go away.
In Uganda?
Okay, not Uganda. But yes, it
because you know what I was going to say? I've only seen that in movies.
No, but it's true. And places that are very cognizant of these kinds of things are going to actually insist that, hey, your leave, so for example, just an example, my wife's workplace, you're expected at the beginning of the year to submit your leave days. Like, when are you going to take leave?
You should know?
You should have decided at the beginning of the year.
Wow.
When exactly you want to take leave. Of course, it helps, even as an organization, for them to know when to plan, to avoid, let's say, everyone applying for leave at the same time. So that's why they ask you to sort of make it up in advance. Or maybe if they have to get a replacement or something like that, it's good if they know in advance. Okay, so much as they ask for it, they don't really push you to go. So,
you said you're not going to be here. Please get out.
Precisely. They don't really do that. So they're happy if you don't take it. They keep quiet and it's like, oh,
she didn't go.
But ideally, it's important that you go away. It's important that you rest, because then you're taking care of your mental health and you're going to be more productive when you do come back from that. So it's important for us to be thinking in that line. So to come to that question, it should be that, hey, we expect you here 8 to 5, and if it closes 5, what are you still doing here? Like, go, or if you were supposed to come in and submit a report and that report is in at 3, go, right? Because you've done what you need to do here. Well, why do we need to keep seeing you here?
Right.
If you're running away from something at home, can we pick it up and help you fix that? Or push you to go get it fixed? It does us no good if you are in up to 10 p.m. and tomorrow you can't show up.
You've highlighted the importance of handling, mistakes that people do at work, having conversations with them to find out. I don't know how easy that would be for, someone in a managerial role, a boss, because most times they're looking at results. And now they have to, let me call it this. They have now to parent you and sit down and be like, darling, this is happening. Why? So when you're talking about it, I raised my hand. I was like, oh God, there was a period. And I think I had gotten in that zone of, I don't like the life that I'm living right now, but I have to show up. And so I was doing things, and then I would submit mistake. Then my boss would be like, you did this. Can you correct it? And sometimes there are very many corrections that I have to make, and then still submit. There is something still. And I'm asking myself as well, what the heck is wrong with me as well? Because do I listen? And he's also asking, do you even listen to when I'm speaking? I'm like, I am actually looking at this document and trying to make sure, because I would be like, okay, so this part is fine. Everything looks like send. And sometimes I've even sent a different document, like, what is also wrong with me? Like, are you kidding? And then I found myself in constant fear that, oh my God, I better not make a mistake. And now this also draws to language. I don't know if you guys ever care for the impact of language used around something, that when you're focusing on, let me not make a mistake, you end up
more like
you just keep bringing them. Let us look at the primary sources of stress in workplaces. Good. What could they be like?
Very good. So I wouldn't go into primary sources of stress, because ultimately stress it could come from all sorts of different. Actually, I think the best way to approach this is, what is stress?
What is stress?
Let me answer that question, right? I think because it will contextualize what I'm speaking about. So how do we define stress? Because if we understand stress, then we're going to understand how it impacts us.
Yeah.
And I think the most important thing for us is, how do I recognize that I'm stressed, irrespective of the cause? Because there will be as varied causes as there are people, but the manifestation is the same. It's stress, right? So it may not be easy for me to understand what exactly is causing it, but can I recognize it? And if I can recognize it, then I can work back for what is causing it for me, because workplaces are different, work environments are different, language is different, but stress is stress. Okay, so what is stress? So we define stress as any type of change that causes physical, emotional, or psychological strain. Okay? Any type of change that causes physical, emotional, or psychological strain. And we all experience some form of stress in our lifetime, or in our work spaces. But stress in and of itself is not the enemy. Okay, we actually have 3 different types of stress. So there's what we call eustress, and eustress here, it simply means positive stress, right?
Positive stress.
Yes, positive stress, right? So to give an example, deadlines, right?
That's like positive stress.
It gets us into that state where we actually have to sort of put in the time. It gets us, it causes a certain sense of push or drive, there is need of some kind of stress if we're going to get things done. Imagine a workplace where there were no deadlines, there were no expectations, just show up. Please give us that work when you think you're ready. Would work get done?
No.
It's very unlikely people will actually get things done and we're not campaigning for that, right? There's need for some degree of maybe expectation, some degree of, call it pressure, some degree of stress. We call that positive stress or eustress, yeah? So maybe, we have new timelines, we have new expectations, so it causes some degree of psychological push in a sense. And that's positive stress, as we call it. Then what we call stress, right? So that's usually that feeling of pressure at the end of a long day, or, we have a deadline this week, and so I'm a bit tense and a bit anxious. And that one also is more normal. It's not in itself pathological. And then we have what we call distress. So distress is more of chronic stress. So it's been going on for, days, in a sense. And that's the one that we are more concerned about on our part, because that's the one that tends to bring about, different issues. So how do I know that I'm distressed, right? So that's how I'll answer the question. How do I know that I'm distressed? I have this stress that, is very harmful. Maybe before I get to that, so what we're calling stress, that, at the end of the day, I'm tired. All I need is to go take a good nap, and tomorrow I'll come back refreshed, right? So that in itself is not alarming. It's expected. My mom, likes to say, if she calls you like in the evening and, how are you? I'm tired. It's like, yeah, that's expected. It means you've done some work today.
I've had that a lot.
I mean, if you're as fresh as you were at 7 a.m,
what is your problem?
Have you done anything with yourself today? Yeah. So it's good that at the end of the day I'm tired, because it means I've actually put in a good day's work and I've done some work. My body should feel that. And that's okay. But if it gets to distress, then we are concerned. So how do I know that someone is distressed or that I may be distressed? The common things that we'll see is rapid changes in mood, right? So you find someone, you walk in, they're happy, and then 5 minutes later they're shouting and yelling, and then they're giving you that eye, and you're thinking, okay, why are you escalating? Like, we were just smiling 2 minutes ago, and now so you notice that these rapid changes of mood, that could be a sign of distress. Calm or sweaty palms, calmy or sweaty palms, right? So my palms are sweaty or tense, I'm having difficulty sleeping. I'm getting all these headaches. I'm fatigued, in the morning I woke up and I'm tired, right? I find that, I have this tension, pains in my neck, in my arms, in the body, my chest is heavy, my muscles are tight. I'm getting frequent sicknesses, frequent illnesses. We have this thing that's happening a lot in the medical world. So you have people coming in, and then you run all the tests, and they tell you, no, all the tests came out clean.
Yeah.
You're stressed. Mm-hmm. Go and sleep. That's a sign of distress, actually, because it's now causing a lot of physical strain as well. So you find that, I'm more sickly, I have, difficulty sleeping and headaches, body aches and pains that I can't quite understand or explain. My appetite is low or extremely high. These are all some of the signs of distress.
I like that you have pointed out the way how stress or mental health can manifest in physical health.
Yes, it does.
And I've had someone, I think, two people on the podcast. One has since been diagnosed with bipolar, but at the beginning of her struggles, she says she walked into a mental health facility, a hospital, and she was just crying, and they kept asking her what is wrong, and she couldn't even articulate that. And then they just looked at her. But she says when she looked back, she was like, I think at that time I needed a hug.
Possible.
Yeah. And then there is this guy who was here, Mona Habit, where he mentioned that he went to see a doctor to run some checkups. And then the doctor realized that, this is happening. So he wrote him a prescription, and he says he moved to a pharmacy. I want to mention the name because it will sound like an ad. He went to a pharmacy in Wandagea where a friend was, and he was like, hey, what is happening in your life? And he didn't know what had been prescribed. They hadn't really explained to him. And then he was like, this shows that you're stressed. Yeah, something is not right in your mental and that's when he gets to understand what's happened, because he says he had moved to a couple of hospitals and they couldn't find an answer. So he just knew it's a mistake. He has to find an answer somewhere.
Yes.
Yeah.
Yes. So, and that's why, like I mentioned, even in my definition, right, that it's going to cause physical, emotional, or psychological strain. Most times it will present with physical strain, right? Mm-hmm. I didn't include it here. I was going to mention it next, but many people today will tell you they have ulcers. So you've heard of that, right?
Very common.
Ulcers. Most common cause of ulcers is stress. Not even H. pylori. Yeah? So you can actually develop what we call stress ulcers. So I come to the hospital, man, guys, ulcers are killing me. Why? You're stressed. Mm-hmm. Yeah. So it can manifest itself in physical pains and aches as well.
Would it be too scientific of a conversation if I ask how it relates to would we be going so much into biology and chemistry?
Yes. We would have to get into a very complex discussion.
I think we'll give attention to mental health manifesting in physical health in a separate conversation.
That would be separate because, just like I've told you about this guy who goes blind.
Yeah.
We see a lot of that. People who so the technical term we use for it now is it's a functional neurological symptom disorder. So there's lots of big words for that. It's a whole field. So I think it could be something for another day.
Yeah, definitely.
But yes, but it can. So it does regularly manifest in physical symptoms. So yeah, when you find yourself going to the hospital and they're doing all these tests and they keep telling you everything is fine. Well, yes, your body is fine, but your mind is not.
Consider mental health assessment.
You need to have that, and that's one of the big things that we are pushing for. That's why we're saying, guys, think mind. Don't just think body. Think mind as well. Yeah.
When we're looking at these forms of stress, do you feel like they're tied to a specific age group?
No. Cuts across, really. Mm-hmm. Cuts across. So we see children coming in with these symptoms. Actually, children will present a lot more with physical symptoms as well. Stress. School is stressful.
School is more like work. No, because sometimes they might. We have these common complaint about Gen Zs. Like, you guys are always talking about mental health. Can you just get the work done? Stop, feeling like we are your mothers.
I think the one thing that is key, or I think a good thing with Gen Z, it's not that they have more stress. It's just they're more vocal about it. They actually have the language.
They have the language.
Which the others didn't. Guys would be in and out of hospital. They wouldn't know what it was. And so for them, they just kept showing up and burning themselves out all the more. The thing with maybe what you call Gen Z is they are more aware, they're more exposed, so they actually will come out and say it. Mm-hmm. The rest of us just didn't know how to even talk about it. But we will, this cuts across, right? So you will have even people in their 40s and 50s, your boss, for example, talk about this experience. Right?
Yeah,
if he was a Gen Z, he would say, guys, I'm stressed. But
and then he
didn't know that, right? So for him, you just vanish. He wouldn't talk about it.
But I think he was aware because by the time I introduced the conversation, he had answers for that.
But he didn't frame it as mental health.
Yeah.
Right? Because he asked you, what do you expect? He didn't call it mental health. Mm-hmm. He didn't call it, he just had his own explanation for it. Or he'd figured out that the solution is to walk away. But maybe in his mind, he wasn't thinking that was a problem per se. It's like it happens and then I move past it. But I don't think in one of his general board meetings, he talked about it. And not because he didn't experience it, he didn't even know how to address it. Huh?
I don't want to say there were no board meetings. Oh my God.
Wow.
Well, let me just...
Yeah, so I think it's not so much a Gen Z issue. It's just that they have the language, or they've seen all these conversations going on, so they can actually be able to point it out and say, hey, maybe I'm stressed out, or I need to take a day, a mental health day, as they call it. They're just more aware of this than we were, or those before us were. Not that we didn't have the same challenges or didn't experience the same things. It's just that we weren't quick enough to sort of spot it out as a mental health issue.
We trailblazed, in short. Those people like calling us old. They should give us credit.
They are enjoying the fruits of
our labor. What do you think we should explore more in these conversations on mental health in workspaces?
So I wanted to speak about something fairly common that now, so we were speaking about stress in general, but when we come into the workspace, that prolonged distress will result into what we call the burnout syndrome. Mm-hmm. And if you're speaking about mental health in the workplace, you have to speak about burnout syndrome. So what is burnout syndrome? That's a reaction to prolonged or chronic distress. And burnout syndrome there are three main things that point to burnout. One of those is the chronic fatigue or the exhaustion, like I'm tired. And I think we hear that all the time, right? I'm tired, guys, I'm tired.
Even in the morning.
The second thing is what we call cynicism. So where I don't like my job very much. Like, oftentimes the day you're given that appointment letter, you're through the roof, you're happy, you're excited, like finally, it's been my dream, to work with this organization. And I went through this rigorous recruitment process and I started interviews and finally I've been given the appointment. So I'm excited, I'm happy. Mm-hmm. And then the same guy, after a couple of months, doesn't like the job. Oftentimes it's because they're burning out, right? So that's what we call cynicism. And then the feelings of reduced professional ability, right? People like to call it imposter syndrome. I don't feel like I can do this. I don't feel competent. It's like I am lying to these people here. I don't feel like I'm as good as they think I am.
Oh, yeah.
So I don't feel as good as I've been before. Like someone else has sort of taken over me. And so that is also a manifestation of burnout syndrome. So I don't feel like I have what it takes to do this anymore. So those are the things that point to burnout syndrome. Yeah. Those are the three manifestations of burnout syndrome: cynicism, fatigue, and reduced professional ability. So it will show itself as poor performance, reduced creativity, so someone comes in with all this innovation and is always coming up with new ideas and, even won employee of the month a couple of times. And then suddenly there's nothing, man. I'm coming out blank. I don't have any new ideas anymore. Or I don't like my job as much. Cynicism, like I mentioned, exhaustion. I'm tired all the time. So these are some of the things that we will see in the workplace that point to burnout, which is really chronic stress.
Mm-hmm. You've mentioned burnout in the angle of syndrome. And I wanted to be like, oh, wait, what? Because I've had burnout, and now there is syndrome. Is there a difference between I'm burned out and I now have burnout syndrome?
Of course we use these words all over the place, right?
Yeah.
But what I'm speaking about now is something that we can statistically define and medically address as an actual problem. Yeah. One of the articles I was reading put the annual healthcare spending due to workplace burnout. This is in the US about maybe $125 billion in a year being spent or being lost as a result of workplace burnout. It's a big problem, and now we have to sort of start to pay attention to it.
Okay, so now we are even going as far as how this burnout can affect the economy of a country.
Oh yes, it does. It does. Yeah. Now this is us trying to quantify what I mentioned earlier. Quantify errors financially. Quantify things like presentism and absenteeism, and all the time I'm going to spend in hospitals doing tests that are always going to come back negative. If you're to put a financial tag to it will be about that. Because of course, people nowadays, they want to hear the financial burden, right? Like
I think it
doesn't make sense until you put some numbers to it. So this is, of course, we've not done such studies here, but abroad they've been able to actually, quantify the financial burden of, work stress, workplace burnout, and the like. So it's a big, big problem. And for us to be able to study it, we had to define it. And that's how we've come out with the burnout syndrome. It's not necessarily a disease, but it's a condition that we recognize as having significant impact and one that needs to be addressed.
Yeah. Thank you so much for that. I did a survey. There is a survey that is out. Let me not make it look like it has been closed. There is a survey on mental health at work that is going around. And one of the things that I shared with you was how shocked I am that both the full-time and part-time workers are experiencing a challenge of work-life balance. And I think we've had a couple of people talking about work-life balance. Hey, you need to do that, work-life balance. And I've not given them full attention, but I've been considering to read and possibly watch content in regards to there is no such thing as work-life balance. And there are some people who are, I don't know, when we advocate, what do others do? They say, misadvocate, I don't know. There are people who are like, there's no such thing. Don't stress people. So is it a myth?
I think one of the ways to look at it is work is part of life. Right. So yeah. Already when you talk about work-life balance, you're repeating yourself because work is part of our lives. You can't really separate work from life. Ultimately, work is in that bracket. So I think for me, the best phrase is life balance. Yeah. And definitely that's something we need to be paying attention to realize that my life needs to be balanced. Sometimes the work-life balance makes it seem like work is the enemy that we need to sort of fight, and we need work.
Yeah.
It's one of those things that's actually very important for your mental well-being. I need work. I need to have something that I do. And that's why unemployment is a big problem. And we can actually have a whole discussion on unemployment and how it affects the mind. So we need work. So don't think about work as the enemy, but how do I balance my life, which includes work?
When you say it like that, you're reminding me of Gordon Myron, where he was saying, I watched him speak about how we shouldn't be asking people what they do for a living, but rather ask them what they do as they live.
Good.
So when you say it like that, I thought it was like a chemistry equation, the way how he was saying it. But now that you break it down like this, I'm like, this is what he might have been communicating.
Mm-hmm. Because the tendency is and I think that's what we need to get into. Some people just end up just doing work non-stop, right? And they're not doing other things, right? Which are also important. And then the tendency is to think that those other things are life, and then there's work. No, but work is part of life, So you need to be able to balance life, which means balance all the different things within this thing that we call life. And work is one of those that's very important. Like we mentioned, I'm going to spend a third of my life at work. So it's something I need to take care of. Also, you realize that the recommendations that we have, I think we're going to jump into that maybe now, is we have to make some changes at work, but also talk about things outside work to be able to balance life.
Mm-hmm.
So there's things, part of the sort of the common work-life balance, there's things we have to do at work, and there's things we have to do outside work. And that's how we sort of solve this thing that we are calling maybe burnout in the workplace.
Mm-hmm.
Yeah.
What are some of the things that you feel like we should be trying to explore?
So we have to look at it from the organizational perspective. We have to look at it from leadership or managerial position, and then also look at it from the individual perspective as well. Yeah. And here I am referring to a lot of work that's been done by the World Health Organization with all these interventions that they've been trying to recommend in regards to improving, mental health in workspaces. Yeah? So there's things that we need to do at the individual point, but also at managerial or organizational level for us to be able to succeed. Okay, so I'll begin with workplace.
Mm-hmm.
Right? So organizational culture. There are a few recommendations that have come up. And again, this can be a whole discussion. So I'm just going to tap on a couple of things. So one of the things that we like to encourage is in the workplace, it's very important to ensure that employees' roles and responsibilities are very clearly defined. It helps if I know that this is my role, this is my responsibility, and it's very clear. And in line with that, to ensure that I have the right resources, the right abilities to be able to do the work that I've been employed to do, right? So I'll speak from my own personal example. I finished med school and I was deployed to Arua, Regional Referral Hospital for my internship.
Mm-hmm.
One of the challenges that I faced up there was, you have all this knowledge, but you don't have the resources to be able to do what you're supposed to do. And that just gets you very frustrated.
Mm-hmm.
I remember on multiple occasions having to pay for drugs for my patients, because, you're out of anti-malarials, you have a patient who has malaria, you see them deteriorating, they don't have money. I know what to do. I don't have the resources. It was when I went to Arua that I saw people die of malaria, I had gotten malaria many times myself. I never thought malaria kills. I read about it in the books, but
in the books, yeah,
it didn't make sense. What do you mean?
It's like back then.
Then I reached there, and I remember this one time, this lady comes with a child, not even 2, maybe 1.5 year old, who's very, very sick, and we run the tests. Malaria, very severe malaria. Child was anemic, and then we know this is malaria, so we need treatment. And so we asked the mom. Of course, there was no stock. So we tell the mom, can you afford to buy? She said, I don't have money. And I said, okay. So, usually we use Coartem and the like. So okay, we have older medication. This was, I think, the time of, it was quinine. Quinine is 1,000 shillings, a vial, right? So I said, okay, get quinine. And it's old, but no, it works. So we can find a way to make it work. It's like, I don't have money.
1,000
shillings. And she said, you know what? Give me my child. Let me go. Right? Like that was it. If let me just take my child, and if they die, that's it. And so I had to pull money from at this point when we'd not been paid for months, right? But I had to get my own money and give them arm to go and buy medication that I could give the child for them to be okay. So there's no way I'm going to enjoy that. I mean, I know what to do, but I don't have the resources. So it's important that we have the right resources for the role that we've been given, and that we also have the right abilities. You find yourself in a workplace where you'll be given work that is above what you're able to do, right? But they expect you to sort of just do it. After all, you're here. Everyone keeps sending down work, right? All the bosses, the manager, I know you do it. So do I have the ability to do the work that I've been given? Is my work clearly defined? Mm-hmm. Are my roles and responsibilities very well lined out? And do I have the resources that I need? We used to refer to it as working in a resource-limited setting. We had to keep improvising things left, right, and center. That's going to cause a lot of frustration, right? So you want to ensure that in your workplace, you have the resources that you need to get things done. Right? I remember interacting with someone who told me, her role involves going to the field to collect information, but they're not given transport, okay? But they're going to expect reports. They're going to expect results. But you're not giving me the means to do it. And so I have to tag from my own money, and yet I'm doing company work. That's always going to cause a mismatch. So it's important that you do that. That will make it more conducive for people to work fruitfully and productively. The other is to provide stimulation and opportunities for workers to use their skills. It's important that you encourage things like innovation or their own input in these workplaces. A culture that really encourages people to sort of own the work that they do is going to be a lot more fruitful than spaces where everything is just sort of dumped onto you and you don't get to have a say. Mm-hmm. It's also important to boost workplace morale, creating opportunities for social interactions. I love that nowadays there's a lot of team buildings going on and getting people to know each other and getting people to really interact. It creates a lot of cohesion in the team, and performance is almost always better. We also encourage rest, leave, breaks. These should be institutional policies, and it's important that as an institution you're encouraging your people to actually rest and take a break, from time to time. Very key and very important. Mm-hmm. Professional and open communication lines. So as an institution, there should be very clear channels through which people can communicate. If it's opinions, if it's grievances, it's important that people can be able to speak up and speak out. Yeah, so that is also very highly recommended in professional spaces. And then, there are quite a number that we go through. But that's very key as an organization. Yeah.
You've talked about policies that should cater for encouragement of rest. And you've reminded me of, I don't know where I saw this. I don't remember, but it seems like a very long time ago where I saw something related to, I think, China, that when they see someone taking a nap at work, they're like, this person is working. Although it could mean something different, like someone just doesn't want to engage. How would you wish for us to close this conversation, Doc?
Yeah, I want to speak about the individual aspects of this. So we've looked at the organizational, but maybe on the organizational element, maybe one way to just summarize all that is I think it's important for every workplace to have a workplace policy around, mental health and how it's going to be addressed and defined at work. So there's many things that can fall into that, discrimination, sexual harassment and the like. How do we address all these things? Because they have an effect on our mental health. So it's important to design a workplace mental health policy that would encompass all these and many other things that we've not been able to mention. And there's good material and guidelines that can help us to sort of design something that best fits the workplace that we are speaking about. But now to just jump into the individual, how can I, in the workplace, take care of my mental health? So one of those is, it's very important to establish open and professional communication, right? So to be able to speak your mind. You talked about how you had to go and speak to your boss about what
it actually felt like a privilege. It actually made me cry when I thought about it. I was like, I don't think everyone can do that.
Exactly. So it's important that I can speak up if I'm not well, if I have something I'd like to mention, if I've been given tasks above my abilities, if I don't have the resources, I should be able to speak up about it. So being able to speak openly and professionally, of course, is key to your own mental health well-being. Respect for other employees and for yourself is also going to be very good. We really encourage, signing up for training programs, often to build your own skills and refresh them. So it improves my competence. It allows me to keep up to date to what's expected of me at work. So that also helps, because if I continue to feel more competent, then I'm also going to be able to deliver more. So it's important that it's not enough. I got my degree 20 years ago and I've never done any refresher trainings, so that's also not going to be very helpful. So you want to keep up to date, read about the work that you do, sign up to journals or articles or content online in line with what you do, because that's also going to help to keep you up to date and keep your mind in a good place. It's also important to, at the workplace, be able to seek help. We have a big problem with that. We think if I ask for help, it means I'm incompetent, or it means
I'm weak.
So
it's a shame.
Make it a point to ask for help whenever you are facing something difficult, or if you, for one reason or the other, are not able to fulfill whatever task that you might have. So yeah, ask for help. That's another big tool that we can use. And then the other is to take care of yourself. So now this is away from working. Take care of your rest. Have 6 to 8 hours of sleep. Actually, someone once said, you have 24 hours in a day. So ideally, that should be 8 hours of work, 8 hours of sleep, and 8 hours to do everything else, right? Spend time with family, have meaningful relationships, eat well, do physical exercise. Yeah. So those things are also going to be very key with regards to your ability to perform at work, right? So part of self-care, or what we like to call, the big 5 for mental health, are key. So sleep, my diet, exercise, and meaningful relationships are very important if we're going to be able to thrive at work.
Essentially, learn how to disconnect from work for you to be able to function at work.
Yes.
Besides us coming up with mental health policies or embracing mental health policies in workspaces, do you have any more information you feel like someone should walk away with?
I'd address myself more to the individual. Take care of yourself. Like I mentioned earlier, the hallmark of mental health is not so much not having stress, but being able to cope with stress. There will be some form of stress in your life of work. And that in itself is not the problem. But if you take good care of yourself, you will be able to cope with that stress and you'll be able to thrive. Yeah. So before you point guns at the organization and call the organization toxic, ask yourself if you are not toxic to yourself.
No one likes self-accountability.
It's important. It's very important.
Yeah.
I remember being invited to speak at one of these companies about this very same topic, mental workplace. And I just asked, how many people here sleep 6 hours? Only like 2 hands went up,
2 hands?
Only about 2 hands went up. Majority of the people are sleeping 4 hours, if they do sleep that day. It doesn't help if I leave work at 5, then binge watch a show till 3 in the morning. Of course, I'm not going to perform tomorrow, okay? So how often do we exercise? How are we eating right? Are we getting enough rest? So if I take care of myself, I'll be able to cope.
Be your first advocate.
It begins with you. It begins with you. Take care of yourself and you'll be able to cope.
Right. Thank you so much.
Most welcome.